Well, if someone has joint issues or the bite doesn't feel right or things like this, and part of my initial exam, I check over 13 different muscles that operate and function around the jaw joint itself. People have heard terms like TMJ, which just means, this is the temporal muscle here, and then you have the masseter muscle here. It's a big one. When you clench, you can actually see it flexing. And between that, there's a joint, so they call it temporal mandibular joint. So the mystery is now taken out of what TMJ stands for, right? But if someone has these types of issues, it gets picked up at my exam, and then usually on my questionnaire, they're answering it. What do we do to handle it? Depends on what the problem is. If it's a joint problem, it's handled a certain way. If it's a muscle problem, it's handled another way. But in the most conservative way that we handle it, generally is with what we call splint therapy. So we find out exactly where the jaw wants to be in its most relaxed position, and then a temporary type of splint can be made so they can test the waters on where that bite needs to be, and then the muscles should relax. Once those muscles relax, then we go, okay, now how do we get your teeth to that exact position? Then we consider either orthodontics or somehow reconstructing the bite, if that's the best thing, or just continue wearing this splint at nighttime. So there's a lot of ways to sort of handle this type of situation. It depends on how severe it is, if it's acute, chronic, and futuristically, where would they end up with no treatment? All those things have to be looked at. And then the materials that we use have to be compatible as well to their body, because there's all kinds of splints that have various plastics. I try to stay with nylons that are most compatible, nylon type materials, and then we end up with a good result that's compatible at the same time.